So you had Dr. Khanna, Dr. Chetan Bhatt, Dr. Chandrasekhar Goda, no, Dr. Jain. So they had talked on various aspects. Like somebody has spoken on medical aspects, somebody has spoken on differential diagnosis, etiology, then some emergencies and chronic abdomen. No, the whole idea is today when I will be talking about is we will try and see what further. So we will begin with this quote. Like if you give a man a fish, he will eat it for one day, but if you teach him fishing, he will not remain hungry ever. The whole idea is that we can listen to many lectures, we can listen to different cases. That would not help us treat them. No? The whole idea at the end of the day, how do we approach? What are the various approaches? If you know the approach, then any case can be treated. Now, very simple thing, when I was told to prepare for this lecture, of course I have treated patients, but while preparing for lectures also I learned quite a number of things which I have never used, never done. So it's how we look at it. Any particular topic is there for us, if we sit down, we study about it, we get so many gems in homeopathy. So I will share something about that also, and then something about the abdominal pain, how we approach and how we should be. We have heard the modern medicine people talking about diagnosis, we have heard modern medicine people of how they manage it. But when we manage and when we present our papers anywhere, it also has to have a substance. We can always talk about I have treated this and it is cured. But then when we present it, we have to also go by some steps. It is universally applicable, universally accepted, better. And that makes us today, the whole world is ready for. So first of all, abdominal pain. Before abdominal pain, we will talk about what is the classification of disease. I am not going to teach organon, all of you know that, so we will not go about that. Why classification of disease? You all must have done the classification disease according to Hahnemann. So when we study abdominal pain, we can also study abdominal pain from Hahnemann's point of view. That will help us whether we can manage this case or we can't manage this case. The first thing when a patient comes to with abdominal pain, we have to decide whether we can manage or we cannot manage. Because any failure in any particular case, the patient goes away from us. Along with that, some part of our reputation goes away. Doctor ko kuch nahi aata hai. So that is not what we want. So first we will need to learn the classification. I think abdominal pain must have been taught to you then acute and chronic. So when we have acute and chronic, so why do we need to know that? The whole idea is for proper management, which includes first we need to diagnose. We should be able to diagnose. Many a times we end up telling it is functional, or sometimes which you don't know. There can be times when we are not aware of the diagnosis, but that should not be because of lack of trying. It should be because you tried everything and nothing came out of it. So concept of diagnosis, what you learned today has in these 3 days has to be applied in every case. So that will help us. Once we diagnose, we should have a prognosis ready. Like for example, a patient of appendicitis comes to us. You have diagnosed appendicitis or somebody else has diagnosed appendicitis and the patient has come to you. What is the prognosis? How will you judge? What will you tell to the patient? Patient has come to us, then appendix is there. It sounds very ominous. Sometimes appendix might burst. People tell you, "Aisa aap treat kaise karoge?" So when will you treat and when will you not treat? So that also has to be understood. So if you diagnose, then you will be able to give the proper prognosis. By learning the classification of disease, therapeutics also is there. Now, why do I classify therapeutics here? When I mean therapeutics means what type of medication. Now, there are schools of thoughts which you already learned, that there is a school of thought which says only one medicine, one dose. There is school of thought which says in acute differently, in chronic differently. So there will be various schools of thought. So instead of going to those schools of thought, we could study from the pioneers, initial, original ones, what they talk. Keep that in mind and try and see how successful it is. That will be much more easier. And then take whatever we get from the different schools of thought, apply it. Then apply it. No? And what diet and regimen will be advised to the patient, and any auxiliary mode of treatment. When you will come to the case, then you will understand what auxiliary mode of treatment needs to be given sometimes. So this is what we talk about classification of disease. Aphorism 153, Hahnemann talks about more striking, singular, uncommon, peculiar signs and symptoms in the case of disease will help us into go into the remedy. No? So that is peculiar characteristic. Sometimes we talk about pain in abdomen. In the right iliac fossa, it could be appendicitis. Can we prescribe on that? We can't. So we need to get some characteristic. But the interesting part is that not all times we get such peculiar characteristic. We get characteristic, but what we are expecting. Now I was going through various pains in repertory. I will show it to you later on. So I found that quite a number of rubrics had only one single remedies, and remedies like which I have never used also. Peculiar remedies like Eupatorium aromaticum. No? So some of the remedies which we have not used. Why we have not used? Because we have not seen the rubric. We have not studied them, therefore we have not used. The only reason why we don't use it is because we don't know about them. We have not studied more about them. And if it was written around 150 years ago, 100 years ago minimum, if it is Kent's repertory, and we are not using it. So we have not tested it, we don't even know about it. Reason some of the times being in undergraduate we have got a fixed group of remedies which we are taught. There are 250 remedies, out of that few remedies are taught well and others are very, this is unproved remedies and things like that, and we finish it. And then when we go through materia medica or repertory, we learn something more. So the whole idea of that first saying is that instead of listening one case from me and telling that I have treated so and so very well, rather when we sit down in our clinic and sometimes go through those topics, read it, we will be in a better position to treat. We will be in a very much better position to treat. One was that, and second, in aphorism 221, Hahnemann talks about, when he talked about 220, that the mind and disposition has to be taken. He was talking about mental disease, but he says this also good to such an extent that the state of disposition of the patient often chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. Now this aphorism has been used as well as misused. When I say used and misused is that what he is telling is that the disposition of the patient is not hidden. You can understand the disposition of, but it is easier said than done. Many times some of the disposition today, human being is become so conceited, we can get confused. But if you are good at it, that is a very important attribute that becomes the basis of the miasm, as what Hahnemann meant. And based on that, you can prescribe a remedy. So if you are a very good physician, if you can find out the mentals at a particular given moment of time, you can give the remedy and that remedy will act. That's what he means. But most of this, this is meant for chronic diseases. That's very important. In Kent's examination of patient, if you go back to Kent's philosophy, there is one peculiar sentence in examination of patient, second chapter, first he says, in acute disease treat with acute medicines, do not try any chronic remedies. That's what Kent says. Now when we talk about Kentianism, we talk about taking the mentals and trying to prescribe, so we get confused. That's one confusion. Then he talks, there's another confusion which we have, that a patient is already with me, I am treating the patient, I have given the constitutional, he is improving, and then suddenly he gets acute disease. What should I do? That confusion sometimes does arise, no, in our mind. What should we do? Never prescribe for any two conditions unless they be complicated. Only chronic disease can be complicated with each other. So if there is an acute disease, it cannot complicate a chronic disease. So if you are giving a constitutional, it cannot be complicated by a acute disease. The acute is never complicated with the chronic.